What I mean.
Forget a question.
Hi, yeah, we actually have a few.
Okay, sure.
Just about like the Tranq or what is the real name for it?
For Tranq,
Yeah,
there was I think it's called like xylazine or something like that.
or
I
something.
think that's the actual drug name.
Okay, and what's the protocol for a xylazine withdrawal?
Withdraw?
Yeah,
Nothing.
nothing. Even
There's
though,
no protocols.
like, what would be okay? Because I know opiates, like you feel like you're dying, but you're not really dying.
Yeah.
But with alcohol, you can die, right?
Correct. Yeah.
And benzos is the same.
Not nearly as dangerous as alcohol.
Not as dangerous as alcohol, but
Yeah.
still can lead to
It can
death
make
and
you feel
cause
bad.
seizures.
Your heart rate can go high. You
It
can
cause
feel
seizures.
nauseated. Maybe. Yeah.
You mean yes? There is a potential that a benzo withdrawal can cause a seizure.
In the strict terms, yes.
Okay.
But using it infrequently in this form, I would doubt that. Yeah, I would doubt that.
Right, I understand that. So I just want to know, like, what a protocol would be for like an alcoholic versus Tranq.
What do you mean protocol?
Well, because Tranq withdrawals cause death and seizures. So why wouldn't you be treating this like an alcohol withdrawal?
I'm a little confused. So you're asking me why I'm not treating her for Tranq withdrawal?
Yeah.
Okay. She's not withdrawing right now, which is good.
So you want her to go back out there and use?
So that's the safest thing.
To go back out there and use?
To prevent serious side effects. That's the same thing with alcohol. The best way
to continue drinking.
Correct. Yeah. That's the only way to avoid seizures and death. Yeah. Correct.
You did take one of them oaths that them doctors take, right?
Okay. Do you have any other
Did
questions?
you take an oath?
Yes.
Do you feel like you're fulfilling that oath? Look at this girl.
I am. She's embarrassed.
You are?
She's embarrassed by you.
Are you embarrassed by me, Frankie?
No, I'm never embarrassed by you.
Do you feel like he is treating you accordingly? Tell me the truth.
I don't know what to say, honestly. I don't know what I need to do. I was worried I need antibiotics, or I'm not really sure.
Yeah.
We just talked about this before you walked in
your
here.
concerns are very legitimate.
Because I need to go to rehab?
No,
Oh.
we're not talking about rehab. We're talking about the fact that you don't feel he is taking care of you, that he's
I just
dismissed
wasn't
you.
sure if you really knew, like, about what was
Tranq.
going on. Yeah.
Sure.
But I don't really know what's going on in there.
Yeah. No, I think your concerns are legitimate.
About the antibiotics things?
Yeah, about all these sort of things.
Well, what
right?
about withdrawal?
So I don't think that's based on her vitals. She is not significantly withdrawing right now.
So you suggest her, like, rather than treat a withdrawal, send her out there to use again?
I understand your concerns, but that's what happens. Yes,
Wait, what do you mean that's what happens?
that's the situation. We're not
That's the
we're not a
situation.
drug situation. We're not a drug treatment center.
How would you, if an alcoholic came in and said, I am, gonna, have alcohol withdrawal, what's
It's
the
a very
protocol for
different
that?
thing. Very different
Why
thing.
is it a very different thing? Because alcohol's FDA approved and
No.
Tranq isn't?
No. It's a very different thing. It's too complicated to get into. So
I'm here, I'm ready to listen.
I
know all about it, Doc.
Okay.
I'm one too.
sure, I have the whole ER to take care of. It's just one doctor today. So she is stable
So
for
she's not as
discharge.
important because you have more
No, everyone's
people
important.
that aren't in drugs?
Everyone is important. Her vitals are stable. There's an emergency
Her
department.
vitals were extremely low, actually.
Yes, and they're stable.
You took them again and they're stable now?
No,
I haven't seen you take them
they're
again.
normal vitals for her.
They're normal vitals for her
Yes,
or for anybody?
she's a small person. I'm not sure what's going on right now. This interrogation.
I don't feel like you're helping her.
Okay. I cannot help her with her.
I don't think you even know. Like, do you know what the side effects of Tranq are? You had to look on a paper to see what it was called.
It's not even on there. So, she does not need emergency treatment for any condition right now. That's what the emergency department's for. If you think she needs treatment for her withdrawal, she needs a different facility, and this is why we gave you these resources right here. These right here.
Do you have the results of the drug test?
Not yet. I'm glad to call you with those results, so you can wait in the lobby or wait wherever you like, and we can let you know the results.
Can you give us a call?
Sure, sure.
Give me your number.
Give them my number?
Yeah.
Is that allowed?
Sure, sure.
Okay. Take your time.
Phone number?
505-506-4338. I have both my babies here.
That's good. That's an awesome hospital.
Yeah, I have a lot of experience with you guys, especially when I was, withdrawing or whatever from opiates. I definitely got better treatment than this little girl's getting.